Hi, I'm Carol.
Hi, I'm Nina.
Welcome to Nurse Practitioners Changing Practice. We have an exciting episode for you today because we're going to do another ranking differentials.
Ooh, I love these.
This is our third one, and I'm going to tell you, it's an interesting case. It's got a little bit of a spin. So let me share my screen with you. And I need to share the right screen. So hold on one second. Just bear with me a minute. And if you are listening, listen for the clues of the case and see if you can figure it out without the benefit of the PowerPoint, right?
Yes.
And I want to get the big screen. Okay, there you go. Now are we all set?
Yes, it looks great, Carol.
Perfect. Okay, episode 3. And again, we want to remind you that the only difference between a novice NP and an expert NP is the size of your library. We need you to build that library of case experiences up to where you begin to recognize things because you've seen them somewhere before, right? And that comes with experience, and experience just takes time. And every patient you see builds your library as well as the cases you hear. Okay.
Right.
We started doing this because we got a lot of feedback that the hardest thing about learning what you're doing is how do I figure out what differentials are and which one's the right one. So we're going to model that and walk through that with you. Are you ready?
I'm ready.
All right, let's see who we're going to meet today. Well, let's go back. She got in there too fast. Okay, we're going to meet Cindy. Now, Cindy comes into your office and she says that she started having back pain about 2 weeks ago that was very, very sharp, radiating down her leg, hurt with any movement. Nothing was making it better. She's been taking Tylenol. She's been rubbing it with Bengay and, got a massage that actually made it worse. It just seems to be constant and it's keeping her up at night. She rates her pain 10 out of 10. So while you're interviewing Cindy, you are finding out that a couple of weeks ago, she went to Disney World. Now, Cindy's a little overweight. She's a pretty big girl, right? And she was walking around Disney World for a couple of weeks, not weeks, couple of days.
Couple days, yeah. A couple of weeks would be expensive, Carol. That would be expensive, Carol.
Yeah. And I know me, I went, I don't know about you, but I've gone to Disneyland, and I have walked around for 2 or 3 days and my feet are,
oh my gosh. And your back and your legs.
But now she tells you something that just kind of, because you can probably figure out, well, you were walking around a lot. You probably aggravated something. You probably pulled something going up and down those hills, right? That'd be totally appropriate. But she tells you that while she was there, she had a day or so that she was, had 106 fever.
Ooh, that's high.
Shivering under the covers. Her husband had to go out. Now, I'm not sure 106 is high, right?
That's really high.
You might wonder, did you read the thermometer right on that one, right?
Well, and she's short of breath, right?
Talking about being short of breath. So those kind of things don't really fit with muscle strain.
No.
They make you worry a little bit. But she said after a few days, it passed.
Ooh,
and
okay.
now, 2 weeks later, she's got excruciating back pain.
So and she's 58. She's 58 years old, for those of you who are listening.
Right, 58. No real history of anything other than obesity, really, right? So we've got our differentials that we think of. The first thing you start thinking of is, well, first we're going to look at her back, right? What could cause her back pain? Well, she could have pulled a muscle, right? Sure. She could have a herniated disc. She is very overweight, so I mean, it's certainly not outside of the realm. She could have spinal stenosis, she's older. Right. The shortness of breath makes you worry a little bit about congestive heart failure.
Yeah.
Maybe. And then we've got this odd one out here just called bacterial endocarditis. And let's just see what we've got.
Yeah, what's that all about?
So muscle strain, you would expect. Lower back pain would be positive, right? Sciatica, probably. but not abnormal deep tendon reflexes, and definitely not fever, and definitely not shortness of breath, right? Herniated disc, we would have low back pain. We could have sciatica. We could have abnormal deep tendon reflexes, right?
Right.
But no fever, no shortness of breath, right?
Right.
Spinal stenosis, pretty much oopsie, I'm going too fast. Spinal stenosis, that's lower back pain with sciatica, but not so much the deep tendon reflexes. Those are usually intact. Congestive heart failure is the shortness of breath. Could bacterial endocarditis cause low back pain?
Yes, referred pain, right?
It could. So let's see how this comes out. It can also cause sciatica. It can also cause abnormal deep tendon reflexes. It can also cause fever. How? Let's take a look at this. How could that come about, and is that possible? Or are we talking about two different things?
Well, that's what I was just going to say. Maybe she's just been sick in the midst of, walking a lot and not being out of shape. So I'm glad you said that.
Yeah, it could have been two different things completely.
Right.
I mean, bacterial endocarditis, you really think of a sick person.
Really sick. And they don't pop, like that fever doesn't just go away. And I mean,
and they
stay really sick.
They're tired.
They're really tired and really short of breath, and they stay sick, and you can't figure out, yeah.
So we're going to run some tests. Let's see what tests.
Okay.
Well, for CHF, what are we going to get? We're probably going to want an echo, right? That's the number one, to see how our valves are working, right? That might even tell us if there's anything to worry about, maybe with the valves. It's not the most diagnostic, but it might tell us something there. So we want to know that. The fever, whatever it is, came and went. So doing blood cultures now is not going to
not going to tell us anything.
Right? I mean, she doesn't have a fever right now, as far as we know of, right?
Right.
We could treat the muscle strain and the back pain with some steroids and see if it gets better, right? And if it doesn't, we're probably going to go on and get an MRI. Right.
And did you think about doing any blood work? Like, would it be worth it to do a CBC?
Yeah, we could do a CBC. Yeah, we could do just to make sure a white blood cell count is normal.
Yeah, see if there's leukocytosis or how high, or
right, if there's something else going on. So in fact, that's a good idea. I put on here her echo was normal. And
yes,
these are real patients, people. These are not made up, right? These names have been changed and all of that, and ages and everything to protect identity, but the echo was normal. Did treat her with some NSAIDs, some prednisone to see if that back got better.
Yeah,
but it did not. And so then of course we get an MRI, right? But the MRI showed a spinal abscess.
Oh my goodness.
So, of course, with the spinal abscess, you're going to send that person to the ER, to be admitted because there's some kind of infection.
Wow.
Fine. When they did the blood cultures, it showed gram-positive streptococcus.
Oh my God. This person's really sick. Yeah.
Gram-positive streptococcus. Yeah. But she was walking, talking, no fever. Only problem was back pain. No fever, doing her shopping, driving into the office, nothing that would indicate that this was a really sick person.
Wow.
Really, really a surprising one. So the winner was, this is interesting to me because I thought, well, this is like, does the chicken lay the egg or did the egg come first?
Yeah.
Chicken come first?
Which came first, the chicken or the egg?
And so what we found out was that what I learned that, I'm not an expert on bacterial endocarditis, but what I found out is that the abscess on the back was seeded from the bacterial endocarditis in the heart.
So it started with the bacterial
endocarditis, which is, you could also find that in IV drug users too, right?
Yeah, I was just going to say, I was thinking, like, what other history did she have?
Yeah,
Did she
she
have any
doesn't.
of that history?
No, but I mean, and I mean, you can't discount it just because of her age, right? But she
Right.
doesn't have that history, but that's something you worry about with IV drug users. So IV drug users that come in with severe onset of back pain, having any history of fever, you would worry about this because it's seeded from the infection of the heart to the spine and grew the abscess there. The abscess on the spine was causing the pressure on the sciatic nerves and everything,
Yes.
causing the sciatica, causing all of that pain. So important for prompt diagnosis. This woman was just downright lucky because in
Yeah.
my estimation, the echo was normal. And I did do a CBC and the CBC was normal. So there was no
Wow.
more fever and she had no symptoms that I could say were suspicious of this, right? So luckily, the fact that I gave her steroids didn't make it worse, right? But the diagnosis of infective endocarditis should be suspected in patients with fever, with or without bacteremia, and are relevant cardiac risk factors. She didn't have relative cardiac.
No, she
She
didn't
didn't
have
have
any
a prosthetic
relative.
valve. She didn't
No,
have a
she had
cardiac
no,
device.
yeah, she had none of that.
None of
No
it, right?
no congenital
None
heart
of it.
disease, nothing.
And there's your
No device. She didn't have a cardiac device, nothing that would tell you this.
no recent dental or surgical procedure.
None of it.
Now, I mean, dental, I mean, maybe she did get her teeth cleaned, and I didn't know that.
Yeah, it
Right?
had to come from somewhere.
Yeah, I mean,
I
it
mean,
could have been, and
yeah,
it may
it could have been dental, could have
given
been dental work. That would be something that we just, I
that
mean,
would have been something I didn't ask about, that maybe she did have her teeth cleaned and it caused the, streptococcus bacteria in her mouth to float and it ended up there. But it does say the diagnosis may be difficult given non-specific symptoms. Well, it was difficult, right? But look at this, a delay in diagnosis and treatment may be associated with complications, including valvular regurg, heart failure, embolic events, and sepsis.
and sepsis. Oh my gosh, she's
Yeah,
so
she was
lucky.
really lucky, right? And so diagnostic tools are blood culture. But again, I didn't do that because she didn't have a fever or any issues. And outside of the hospital, drawing blood cultures really isn't done because they're usually
Right.
not that sick, right?
Right.
So
Well, the key that you
but I
did,
did the
you did the
echocardiography.
echo, but you
I
did
did
the
the echo,
MRI. You didn't
right?
mess around. She was having a lot of pain that wasn't going away. You got the
No.
MRI and that found the abscess.
Well, and I got the echo right away. I did
Yes.
get the echo right away and it didn't show anything, but it tells you that they have to do the TEE,
Yes,
to be able
absolutely.
to look at the valves more, where an echo doesn't really show you the valves to that degree.
Yeah.
So this is from Up to Date, guys. For those of you that have access, many of you are in schools that have Up to Date available for you in your library. Others work at institutions where you can get Up to Date. Take a look at bacterial endocarditis and familiarize yourself with it. Sometimes it's not that traditional patient. I
Right.
never would have suspected that.
Well, and the history, really knowing she was sick,
This
right?
106 fever.
That was like really odd and really something you should take notice, even though she got quote unquote better. I mean,
That's why I got the echocardiogram. I wouldn't get an echo on somebody that I was, but I actually got the echo because I was thinking, well, maybe she does have some congestive heart failure.
right. That's what I would have
know?
thought too. If she was short of breath, I'm like, well,
She
maybe
was short of breath and
maybe
she
it's
had some
cardiac
swelling in her legs, but she just
yeah.
was Disney and she was big and she had some lymphedema anyway. So she kind of always had swelling in her legs. So it was like, I didn't do the echo to rule out endocarditis.
No,
I didn't think of that. That was like,
no, I would have thought of heart failure too. But I really like the fact that you didn't mess around and you got the MRI at the spine because the back
and she
pain
was
was still
admitted.
there.
She was treated and the IV antibiotic course was for 6 weeks. So of course you come home. They, did the workup and did the TEE and did everything.
Wow.
And then they did the antibiotics and she didn't have any sequela from it. But I mean, just lucky. But my takeaways were, back pain might not be benign. If it is with a fever, maybe I should have done that MRI first and not given
Well,
steroids.
maybe, but I mean, but you got it. Sometimes with a patient like that, I might have thought, echo, yeah, such a short of breath. And then I might have gotten an x-ray first. An x-ray wouldn't have, I mean, if I would have, you would have messed around for another week, have them come back or call and then wait, the fact you went right to the MRI because it wasn't going away or was getting worse. Sometimes we're hesitant to get an MRI because we worry about insurance, but if you have the symptomology,
if you've got neurological symptoms,
yeah, if you have neurological symptoms and you've documented and it's worsening, there's not going to be a denial there.
And that was my thing. I did put her on a short course of steroids, and it got worse.
It got worse.
Yeah, and so that gave me the justification to get the MRI. But all good things. I mean, we learn as we go, right?
Yeah.
I probably wouldn't have done I probably would have done the MRI now, looking back. I would have.
Yeah, but I would have done the same thing. I would have said, a little burst of steroids. I think I better check in. I mean, I would have done, it sounds to me like I would have done the same thing. I would check to CBC, nothing there, worried about the shortness of breath. She's got a little lymph. I would have done the echo. I would have done maybe a lumbar spine x-ray. I wouldn't have jumped to an MRI, but I would have done a little short course of steroids and non-steroidal anti-inflammatories to see if she got better. I mean, that's all, evidence-based. And then she actually got a little worse. So then you got to step it up. So yeah, nobody would have gone to an MRI first.
But that's just to show you that sometimes our physical exam, obviously our physical exam, and just in this aside, you are justified in getting an MRI anytime you have neurological symptoms. So
that's
she
right.
has tendon reflexes that were down,
Yep.
A little less on one leg than the other, a little less strength in one leg than the other,
Yes.
positive straight leg raises, anything
Yes.
else you can think of, then you are
no, it's the reflexes, the strength, measuring strength, and the straight leg raise. Sensation, decreased sensation.
So there we go. So we kind of walked you through something that would be what we thought initially might be just plain old muscle strain, or at most a herniated disc.
Yes.
And turned out to be really something quite extraordinary.
That was a great case. That was a great case.
So we're going to keep bringing these to you.
Yeah.
Okay?
I hope that was an interesting one for everybody listening or watching.
Give us feedback, please. Like, share, subscribe to our YouTube channel, and let us know in feedback what other things you would like to hear about. Talk to you next week.
Bye-bye.
Bye.